For my presentation, I'm going to be talking about gluten. The first question I would like to answer is, what is it? Gluten is the name for proteins that are found in wheat, rye, barley, and triticale, which is a cross between wheat and rye. The two main proteins found in gluten are glutenin and gliadin. The reason why gluten is used in so many foods is because it creates a glue-like consistency, which is very useful in making doughs. Although these four grains that contain gluten are different, they all possess similarities caused by the unique texture gluten supplies. Wheat is most commonly found in things like bread, soup, pasta, and cereal. Rye is most commonly found in things like rye beer, rye bread, and cereal. Barley is most commonly found in things like food coloring, soup, beer, and brewer's yeast, while triticale is most commonly found in things like bread, pasta, and cereal. The two components of gluten, glutenin and gliadin, one is soluble in water, while the other is insoluble in water, making the gluten mesh structure. The gliadinins in gluten are classified as alpha, beta, gamma, and omega gliadinins. Gliadinin is responsible for the negative health effects associated with gluten. To help understand how gluten is used in a cooking way, I've provided a video to watch.
Gluten is formed by the proteins glutenin and gliadin, which are present in wheat flour. These proteins are not soluble in water. Dry flour on its own cannot develop gluten. It requires water or liquid in order to be developed. The first stage in developing gluten is to add water or liquid to the flour. The mixture is then agitated until a glue-like substance is formed. In the second stage, more flour is incorporated until the mass starts to form a ball. The mass will initially look very rough as the proteins are initially coiled and scattered throughout the mass. During the third stage, the proteins are stretched and elongated through the act of kneading. We can demonstrate this by using coils. These coils represent the proteins glutenin and gliadin, which start out scattered. Through kneading, these coils are elongated and aligned until they form gluten strands. As the dough is kneaded, the gluten networks begin to stretch and develop even further, making the gluten strands more cohesive and elastic.
The question many people wonder is, should gluten be avoided? The answer is, gluten should be avoided in patients that have celiac disease, gluten sensitivity, or allergies towards gluten. If a patient does not have any health factors and can tolerate gluten, it is perfectly fine to eat. People who have celiac disease cannot ingest gluten because it leads to damage in the small intestine. 1 in 100 people are predicted to have celiac disease. Celiac disease is an autoimmune disorder, which means the immune system mistakenly attacks your own body. People who are forced to avoid gluten due to this condition are found replacing their normal grains with things like amaranth, brown and white wild rice, buckwheat, corn, almond meal, coconut flour, and many other substitutes. Here are my sources for creating this presentation.